As a dermatologist, we never recommend popping pimples, but it's especially important to avoid popping pimples in the triangle of death on the face. So as the name applies, it's really the triangular part of the mid-face. So it spans from the corners of the mouth all the way up to the bridge of the nose and then extends down to the upper lip. And the name is really derived from the fact that simple skin infections can potentially lead to complications and death. And that is because in this area, there's a collection of blood vessels that are interconnected, including ones that drain from the brain. So popping pimples in this area, as harmless as it may seem, can introduce bacteria that lead to infections and can quickly spread to your brain. Although this complication is fairly rare, if you have a pimple, it's best not to pop and see a dermatologist for a quick fix like steroid injections.
Is she done? Oh my God, I can't.
Things you didn't know, right?
Wow. So she was a dermatologist?
She is a dermatologist.
She's a dermatologist. Yeah. I have so many things to say about that. First of all, triangle of death? No. I am an esthetician who has been working in this industry for 20 years. And in 20 years, I have squeezed so many people's noses and in between their forehead and on the sides of their nose and their upper lip. And I have never killed a single person.
I'll be honest, I do it sometimes even on myself because there's a whitehead there. You know, it's one of those things where this is something that's taught in residency, dermatology residency.
It is?
It is.
What?
Because, you know, she mentioned it is rare. There may have been a reported case. It's hard to know the exact association, but because there are vessels that connect the superficial part of your circulatory system with the internal part, there is technically that little connection where I don't think it's something that people think about on a regular basis, but they actually do call it triangle of death, which is very dramatic. And it's very scary.
So dramatic.
It's very dramatic.
Oh my God. I mean, the amount of clients that I have that squeeze their face in this area all the time, hundreds and thousands and probably millions of people who do that.
And no one that you know has died.
I have never heard of anyone dying from squeezing their nose. And I have never killed anyone. Have you?
I have not killed anyone.
I mean, and you've squeezed inside. I mean, somebody has to push so hard in that area. I mean, how would you die? Causing an infection. You cause an infection in the blood vessels.
Yes.
I mean, you would have to be.
Yeah. So I mean, it depends on, you know, if someone has a fulminant infection in this particular area, and you're kind of messing with it, and you can get something called sepsis, or like you get bacteremia, so bacteria into the blood. And the thing is, in general, most people who are healthy, that's less of a problem. Your immune system takes care of it. But this is a large bolus you're putting into this area, and it just happens to go into your deeper circulation. There is, you know, theoretically that chance that it can set up shop in the brain and cause other issues, which is what
I understand that. But also, I know people who have pickers, you know, because working in a dermatologist's office, you get the really bad cases where they're, you know, severe pickers.
Sure.
And so they pick so deep and they dig so deep that they cause divots in their skin, scar tissue, big old scabs. Pick the scabs, and they haven't died either.
They haven't died, not yet.
But I mean, at that point, they're at the dermatologist's office and they're getting medications for it and stuff like that. Yeah. But I mean, to be so drastic to never pick your nose or you could die is very dramatic.
I think it is very dramatic. I mean, certainly even in the office, like as a dermatologist, like we don't even do extractions, you know, in an actual visit. We usually do the injections. We do give medications. We do counsel on ways for, you know, zits to be popped in certain ways, but certainly we say like, let that zit mature a little bit where it will drain on its own. That is the safest way, right? But certainly if you're going to pop the zit and you have infections in the central part of the face, I think it's just saying that it's not always 100% safe because you could technically get bacteremia, which people get even from brushing their teeth. Yeah. Right? You can get bacteremia from brushing your teeth. So everything has a risk. Yeah. And I think this is not bad information. It's just a dramatic terminology.
Dramatic. I mean, if you pick a pimple on your nose, I'm gonna have to be safe enough to say you're not gonna die. I don't think you will die. But also, she said if you get a pimple, go to the dermatologist and have them inject it with cortisone. And I just want to clear that up by saying Every pimple is not going to need to be injected with cortisone. The only time you need to get injected with cortisone is if you have a cyst that's encapsulated with P bacteria, and the only way to like really get that to go down, because you never want to pop that, is by injecting it with cortisone. But if you injected every pimple with cortisone, you would have little indents all over your face.
Yeah, I mean, there's safer ways to inject cortisone where you use very low concentration. So it's not necessarily you will always have the indent, but you're right. I think.
But a person isn't going to go to your office and go, right. I have a face full of pimples. Can you inject them all with cortisone? Because she said that you could do that. You're not going to sit there and inject all of her pimples.
I think that most of the issue is that you're not going to be able to get into a dermatologist's office to get injected when you actually need to at that particular moment, right? Like in our office, we do prioritize that for people who really need to come in for something. So there's a special event, or it really is a very painful pimple. Like we do prioritize that to get people in the same day. But not every office is able to accommodate people on the same day, especially, some places are booked out 3, 4, 5 months.
Yeah.
There's not going to be an option for you to inject that pimple that is there.
And so the pimple that she's referring to, I think in the video that's not clear, is a pimple that has to be injected with cortisone. Is something that's under the skin, and if you squeeze it or try and pop that, you can actually implode it, and it can spread around and cause a whole bunch of bad things. And you also aren't going to be able to get it out anyway. So without like causing a really bad scar on your face. So in that case, yes, go to a dermatologist and get a cortisone injection. But you can also do a warm compress at home if you can't get into the dermatologist's office. That'll help to bring down the inflammation in that pimple. And you shouldn't pick any pustules anyway. You should go and have those extracted. So seeing an esthetician who is skilled in extractions and more on the medical side, or going into a dermatologist, is always a better way to deal with acne in general.
I think that's great advice. It's also one of those things where I do want to remind people that not every pimple needs to come to the surface. Some of the deeper ones, especially hormonal acne, your body can resorb it and the inflammation can go away on its own. So not everything needs to come out to the surface.
No.
And I think that's a mistake people always make, is that, it's deep, I need to get it out.
Yes, that's a big no.
That's a big no. Yeah, exactly. That's when you get the scarring, but that's, I think, in this particular case, especially deep cystic pimples, are kind of where you can get large pockets of infection. And if you try to squeeze it and go deeper, you get some of these issues.
So maybe she was talking about cysts or cystic acne or something, and we just got a clip of the video. Yeah. I don't know. This triangle of death freaked me out.
Very scary. It's time for Halloween.
I think I'm gonna have to find a new career.
On that note, thank you very much for joining us.